Blood pressure is a vital sign that tells us about the force of your blood pushing against the walls of your arteries. It's a key indicator of your cardiovascular health, and understanding it is the first step in managing conditions like hypotension. Think of it like water flowing through a garden hose. The pressure of the water determines how far and how effectively it can reach the plants. Your arteries are the body's delivery system, responsible for carrying oxygen and essential nutrients to all your organs, ensuring they function correctly. So, the pressure needs to be just right to ensure adequate delivery without causing damage. Too high and it strains the system, too low and vital organs may suffer. Low blood pressure, also known as hypotension, simply means that this force is lower than what is generally considered normal for healthy bodily function. Now, for some individuals, low blood pressure is harmless, and in some cases it can even be a sign of good cardiovascular health, particularly in athletes. However, for others, it can lead to unpleasant symptoms like dizziness, or it might be an indicator of an underlying medical problem that needs attention. When blood pressure drops to a dangerously low level, your brain and other vital organs may not receive an adequate supply of blood, potentially leading to serious complications. This can manifest in various ways, with one of the most common symptoms being lightheadedness or feeling faint. Blood pressure is always expressed as two numbers, a top number and a bottom number. The top number is the systolic pressure, which represents the pressure when your heart contracts and beats. The bottom number is the diastolic pressure, reflecting the pressure when your heart is at rest between beats. Generally speaking, a blood pressure reading below 90/60ths mmHg is the threshold that is generally considered to be hypotension, or low blood pressure. However, it's important to remember that what constitutes low can vary from person to person. Ultimately, the presence and severity of any symptoms are often more important than the absolute numbers on the monitor. Indeed, many healthy and active individuals naturally have lower blood pressure readings without experiencing any adverse effects. Doctors typically become concerned about low blood pressure only when it starts to cause noticeable and disruptive symptoms. Symptoms that interfere with your ability to carry out your normal daily activities and enjoy your life. Therefore, it's crucial to always pay close attention to how you are feeling and any changes in your overall health. Don't rely solely on the numbers on the blood pressure monitor. Your body's signals are just as, if not more, important. Low blood pressure, while often asymptomatic, can be a cause for concern for some individuals. It's important to understand who is at a higher risk of experiencing this condition. Older adults, particularly those over the age of 65, are more susceptible to low blood pressure due to age-related changes in the body's regulatory mechanisms. Pregnant women often experience fluctuations in blood pressure, and low blood pressure is not uncommon during the first 24 weeks of pregnancy. Individuals with certain pre-existing medical conditions, such as heart problems like bradycardia or heart valve issues, or endocrine problems like diabetes and adrenal insufficiency, are also at an increased risk. There are different types of low blood pressure, each with its own set of causes and characteristics. Orthostatic hypotension, also known as postural hypotension, happens when you stand up too quickly from a sitting or lying position. This sudden change in posture can cause dizziness, lightheadedness, or even fainting. Postprandial hypotension occurs after eating a meal, especially in older adults. This happens as blood shifts to the digestive system to aid in digestion, potentially leading to a temporary drop in blood pressure elsewhere in the body. Dehydration is another common cause of low blood pressure. When the body lacks sufficient fluids, it leads to lower blood volume, which in turn results in lower blood pressure. Certain medications, particularly those prescribed for heart conditions, depression, erectile dysfunction, or high blood pressure, can sometimes have the side effect of lowering blood pressure. Significant drops in blood pressure can also result from blood loss due to injury or internal bleeding. A severe infection, such as sepsis, can lead to a dangerous drop in blood pressure. Similarly, severe allergic reactions known as anaphylaxis can cause a sudden and life-threatening drop in blood pressure. Both sepsis and anaphylaxis are medical emergencies that require immediate attention. Underlying heart issues, such as an abnormally slow heart rate, bradycardia, or heart failure, can also contribute to chronic hypotension. Accurately identifying the underlying cause of low blood pressure is key to determining the most appropriate course of treatment. It's crucial to always discuss any new or worsening symptoms, as well as any potential medication side effects with your doctor or healthcare provider. Understanding your individual risk factors for low blood pressure can empower you to proactively manage your health and potentially prevent future problems. It's important to stay alert to any changes in your body and overall health, especially if you belong to a higher risk group. Regular medical checkups and open communication with your healthcare provider are essential for maintaining optimal health. Dizziness or lightheadedness is the most common symptom, especially when standing up quickly. Fainting or syncope can occur if blood flow to the brain drops too much. Other symptoms include blurred vision, trouble concentrating, and unusual fatigue. You might feel weak, nauseous, or notice cold, clammy skin. Rapid, shallow breathing and a weak, fast pulse can signal more severe hypotension. Pale or cold skin may also appear. If these symptoms are frequent or severe, talk to a healthcare professional. Don't ignore persistent signs. Your body is telling you something important. Doctors start by asking about your symptoms, medical history, and medications. They'll check your blood pressure in different positions to spot postural hypotension. A physical exam and listening to your heart and lungs help rule out other causes. Blood tests can check for anemia, low blood sugar, or hormone problems. An ECG may be done to look for heart rhythm issues. Sometimes you'll wear a 24-hour blood pressure monitor or have a tilt table test for more details. These steps help pinpoint the cause and guide treatment. Managing low blood pressure often starts with simple lifestyle adjustments. These changes can significantly improve your well-being and alleviate symptoms. It's about finding a balance that works for you. Staying properly hydrated is key, so drink more water throughout the day. It's also important to avoid alcohol, as it can lead to dehydration and further lower blood pressure. Some people may need to increase their salt intake to help raise blood pressure levels. However, it's crucial to do this only with a doctor's advice, as too much salt can have other health consequences. Eating small, frequent meals throughout the day can also be beneficial. This helps to prevent sudden drops in blood pressure after eating, which can cause dizziness or lightheadedness. When standing up, do so slowly and deliberately. Flexing your legs and ankles regularly can also help improve blood flow and circulation. Elevating the head of your bed slightly can reduce morning dizziness and lightheadedness. If symptoms persist despite these measures, compression stockings may provide additional support. In some cases, medication may be necessary to help raise blood pressure to a healthy level. Remember, treatment is always tailored to your individual needs and the underlying cause of your low blood pressure. It's essential to always consult with your doctor or healthcare provider. Seek medical attention promptly if your symptoms are severe, frequent, or significantly impact your daily life.